About 248,300 adults in the state of Kansas have been diagnosed with some form of diabetes. About 13,300 new adults are diagnosed every year. Hi, I'm Leslie Mack. I'm a nurse practitioner, and I work with people who have diabetes at Salina Regional Endocrinology Clinic.
Well, Leslie, thank you so much for coming on the show. We're going to talk a little bit about diabetes and about continuous glucose monitors. First of all, tell us about diabetes and who needs these monitors.
So diabetes is a metabolic disease in which the body has a hard time using the food that we eat for fuel. That's it. And so we try to help the body use food for fuel the way that it needs to. And when we do that, blood sugars stay nice and even. So people who would benefit from the use of a continuous glucose monitor would be anybody who wants to know what their blood sugar is doing. The finger stick blood sugar monitor, for example, you take one picture, it's like a Polaroid snapshot of what your blood sugar is doing, whereas the continuous glucose monitor is the motion picture of your day. So it's really easy for us to see how medications are working to help your body. Are the medications doing what they're supposed to do so that you do metabolize your food the way that you need to? So there are a couple of different patient types who can use a continuous glucose monitor. These days there are monitors available for people who just want to know what their blood sugar is, and you just put it on, connect it to the app on your phone, and away you go. So people who are like working on weight loss or perhaps are following some sort of particular diet, those services could be really helpful for that. Then there are people who are on medication for diabetes, particularly insulin.
All this can be pretty confusing for the patients, I bet, which is where you guys come involved, right? Let's talk about what you do with the patients there at the endocrinology clinic.
Well, let's say, for example, you come in and we don't really know what's going on. Your A1C is high, and you're doing finger stick blood sugars, but we're still not getting an answer. We might use a continuous glucose monitor there, even temporarily, just to sort of get a picture of what's going on in real life, in real time. Another example would be somebody who's on insulin and we really want to drill down and get that A1C down. It just enables us to confidently adjust medications for those individuals.
Thank you so much for coming on the show and for some great information. And thank you for watching. For more information, please visit SalinaRegionalEndocrinology.com and like Salina Regional Health Center on Facebook. Follow us on X and Instagram.